I don't think we are yet.
Oh, here we go. I think.
Oh, I see it now, live on
There we
Facebook.
go.
Okay, great.
Yeah.
You did
Hey,
it.
everybody. My name is Kat Bodkin with Low Country Autism Foundation, and Sophia Towns, our program coordinator, is joining us, as well as Becky Peters with the ARC of South Carolina. She is the Director of Operations, and we are so excited to be with y'all today. Can you guys hear me?
I can.
Okay.
Can you hear us, Becky?
I can, yeah.
Great.
Okay, good.
So we are so excited to talk about case management and waivers, and I'm gonna turn it over to Becky so that she can introduce herself.
Okay, sounds good. I'm Becky Peters. I'm happy to be with y'all today. I have been doing case management for lots of years. I have been with the ARC of South Carolina as director since January, and prior to that, I was at a different case management agency for, gosh, almost 18 years. So I have lived and breathed case management. I love it. I feel like it's the glue that keeps all the supports in place. That's who I am. And we have a great case management program here. We were talking earlier, y'all, case management, understanding services in our state, it is such a complicated thing. And if you know someone that has a loved one that is special, has some special needs, make sure, it doesn't matter who they're with, make sure they get connected with a case manager. We have run into situations where we've been in classrooms serving one individual, and the next little man next to him, who is also 17 years old, has never even heard, the family hasn't even heard of case management, and they're sitting in special ed, and so we want to, our biggest thing here at the ARC is advocacy and outreach, education. The worst thing a parent can say to me, I shared with the ladies, was, I didn't know. And then it's 6 years later and you've lost this time. So as we kind of talk about case management, y'all feel free. I will maybe send a picture of my card that you can also post, Kat. I told the ladies I'm going to give you guys some just real general information sheets that will also be posted. We'll be talking through these, in our time today. But feel free to reach out, ask more questions, ask any question. There's so many loose pieces out there. And it's hard for us to figure out. It's hard for me sometimes. And I've been in it for so long. So, coming in new to the system, I can only imagine what that feels like. So.
You guys are angels for moms like us. I'll be the first to admit that I didn't know about case management and waivers until a few weeks ago, and the ARC has helped me navigate that. So thank you so much.
Yeah, absolutely. Well, Margie has a passion, and I think a little bit of the difference for us at the ARC, and the reason the advocacy is so big and Margie fits so well with this national organization is she also has a child with autism. And so she's lived it, and she's promoting it, and she's digging in deep with it and doing all those things. So it's just been a wonderful experience being over here, and just really being able to get into that piece of advocacy that we all need at any given time.
So if we were to, we can use me as the guinea pig. If if I was looking for case management, would I just call your number? What's the first step?
Right. So we can talk about it maybe in a couple of different realms. Like, what if you were new to the state? How about that? So if you're new to the state, you actually have to come in through the Department of Disabilities and Special Needs. Okay. So I do have a piece, a flyer for you on this. So don't worry about taking notes. It'll be here for you. In our state, Department of Disabilities and Special Needs is our state agency for intellectual disabilities, autism, and actually head and spinal cord injuries as well. Okay. So sometimes you hear in the community, I've got a DDSN case manager. Well, what that mainly means is that you have a case manager that is contracted with DDSN. They don't necessarily work for DDSN. In each county, there's a county board. Okay, and that county board for right now today, and lack of a lot of explanation with conflict free coming in, that county board carries case management. Okay, every single county. After that, you have private providers that also carry case management. We're all right here contracted with DDSN the same way. No one can access more or less funding programs. There's no benefits to one or the other. It's just who you connect with. So when you're out of state, you've got to come in and get eligible with this Department of Disabilities and Special Needs. Couple of ways to do that. Sometimes you have to have another evaluation. Sometimes your child or your loved one has to have another evaluation. Or sometimes there can be a records review if you've been evaluated out the yin yang, right? And no need for any more evaluations. You can actually just give your paperwork to DDSN and they can review it. Once your child, your person becomes eligible for DDSN, you get to choose your case management agencies. Okay, they typically give you a list. What I suggest families doing is call people on that list, see who you can get in touch with, ask them about their program, ask them what their case management looks like. It does look different to a degree. We're all under the same guidance, but I think depending on the agency, there are some agencies that don't serve some counties. There are some agencies that maybe do a little bit more home visiting than another agency. We're all under the same rules, but sometimes it just looks a little bit different. So I encourage families to do that. You're never stuck. You choose one agency and that person comes and talks to you and you're like, yeah, I don't know. It's not a match. You're never stuck. All you have to do is, if you're in this situation, call DDSN back and say, hey, I actually want to change my case management agencies. Okay. So if you're already in the system with a case management agency that's not meeting your needs, or you might hear that one of these county boards might be losing their case management program because of what's going on in the state, and you have to choose another. What your case, you can do it two ways to switch. Okay, you can tell your case management agency, hey, I'm just ready to go. I've connected with this parent over here, and this parent, has spoke wonderful things about this program, and I'm going to switch. You can actually call your current case manager and do it that way. Or you can call the case management agency you want to go to, and you can say, hey, I'd really like an acknowledgement of choice form to sign because I'm not really getting my needs met here. I need to move to you. Okay. So at that point, you can transition. You're out. You don't have to talk to your previous case management agency, and we can request the file from the other case management agency. One thing I do, though, before people transfer, y'all, just because Margie and I both, I've been her child's case manager for a long time, 12 years. So, and we were at different agencies. We've never had that competition feel. And so if you were to call me and say, I want to switch now, I might say to you, have you tried the other supervisor? Have you tried the other agency supervisor? Are you sure that maybe someone's just not out sick or, something like that? I'll try to go down that route because it's really just about getting families served, and it's not about who you're with at the end of the day.
We have a question, Becky.
Okay, sure.
Is it okay if I interrupt as questions come in?
Yes, please do. I love that.
Okay. Well, we have people listening and we have a question. What do we do if we are having a hard time getting in touch with DDSN? And we know because of the pandemic, there's been some issues with people getting in touch over there. Is it just paperwork we need to fill out? And can we get it online?
Okay, so are we talking about completely brand new to the system?
I don't know.
Like intake into DDSN?
Um, well, from what their question states, I would think that they are trying to get in touch with DDSN to get intake.
Okay.
Yeah.
So yes, you can actually go to their website and well, I'll tell you this, y'all. They're not allowing you to do it online anymore. So they were, and they took that link off probably 3 to 4 months ago. So you do have to call an intake line. So when you're new and you don't have, what we have seen too, y'all, interrupt my own self. Sometimes you have lost touch with your case management agency and you don't know who you were with or anything like that. That doesn't mean you're closed out to DDSN. If your child was 1 and you might have done BabyNet and now they're 24 and you just can't for the life of you remember, you can call me. I can look up on the system if you're actually in the system still or not. Okay, so that's kind of that does affect some folks because you just lose touch. But in this situation, I would tell you, and this flyer that I'm going to give you will tell you, gather up all the information you have. Call the 1-800 number. DDSN has not been working full time at the office in downtown Columbia, but there's an answer machine, and you can leave a message. They should.
You know, us caregivers don't like leaving messages.
I know. You got to do it. But if you're having like extreme trouble, like it's been weeks, we have a connection at DDSN. Again, just give us a holler. We'll shoot something up to DDSN. We have a great working relationship with them, as the state agency, and we participate in most of their pilot programs and meetings and things. So we're happy to find that out. Like, why is no one calling this family back? They have to get in.
Yeah.
Well, that's huge. We definitely have had some feedback about how it's been difficult to get in touch with DDSN right now. And we haven't really had a good answer for that. So it's great that you have that connection and you can let everybody know kind of what's going on.
Absolutely. I will tell you, it's kind of funny because at the top of their website, if you go to the DDSN home website, it says applying for services. DDSN continues to accept eligibility applications according to the normal processes. So we know that's not happening. And
Right.
We give everybody some grace. This is a crazy time and people are out of the office who didn't expect to be, and all of that. So
I have a question because this was something relayed to me. So when you have an early interventionist working with you and you age out of BabyNet, are you automatically given someone else and that turns you over to case management? How does that transition work?
That's a great question. So typically at age 3, our kids have to establish, I'll say lifelong, semi-lifelong disability, right? In order to continue with early intervention. So that means it has to be a little bit beyond a speech delay. It has to be a little bit beyond gross motor. It has to be a little bit more to it than that. Do they have to have a full-blown diagnosis of autism right that second at age 3? No, because what could happen is at age 3, you could get either a time-limited eligibility with DDSN or an at-risk DDSN eligibility category. Okay, those two categories. With the time-limited, you guys can stay in EI, and I think with at-risk you can too, up until the age of 5. And then at 5, there has to be a little bit of a justification in order to go to the 6th birthday, right?
Okay.
So that's kind of the progression of the EI if you want it that way. If at 3, you say, I can't do the weekly visits, I just need somebody to connect me with resources. If your child has that time limited, you can come straight over into case management at age 3. You don't have to wait till age 5 or 6.
So the biggest difference in staying on with EI would be you're having weekly in-person visits if everything's normal without COVID.
That's right.
Okay.
That would be the reason. If you're still focused on development and you need that piece, you stay put. And at the time that you and your EI decide, okay, your schedule just doesn't have it anymore. He's getting OT, PT, and speech. No need for EI right now. Not that EI is not so very important as well, because it is. But you decide with your EI, she or he should then offer you a choice of provider of case management agencies in your area. Okay. Unfortunately, we don't have the beauty of doing a joint visit with the EI. I wish we could. That's always been my dream. I wish case management could go out and do the last visit with EI. Doesn't work like that. But we have established really good connections with EI companies that, we get a referral from the EI company. If we can't get in touch with the family, we'll contact the EI and say, hey, I've been trying. We know they're going to call you anyway, so just let them know, because it's hard after you've had that EI and that person with you forever to start with someone new and tell your story again and start over. So I really encourage our case managers to really coddle, our EI families, because they're used to that contact, and it's hard. It's just a hard transition. So, does that answer?
Yes.
Okay.
Yes, it does.
So let me
Thank
talk
you.
real quick. This is probably a good place to input active case management versus inactive case management. Okay. The inactive does exist. And when I say inactive, I do not mean that you're not eligible for Department of Disabilities and Special Needs services. Okay, once you're eligible, fully eligible for DDSN, you stay fully eligible for lifelong. Okay, there's times when you have a time limited eligibility, they might require another test, another psychological at 6 in order to establish the full eligibility under related disability or intellectual disability. So in case management, there are lots and lots of families that are eligible for DDSN, right? The ones that have our waivers, the ones that have the HASCI, the ones that have the IDRD or the community supports waiver, they all have automatically active case management. Okay, so that means they automatically have a support plan, assessment, they're getting the home visits, you got to do the paperwork, you got to sign the forms, the whole gamut of things, because you're enrolled in this waiver that's actually a funding source that is over and above what your regular Medicaid is going to cover. Okay, we have this other group of folks that are inactive. They may not have needs right now, this minute, right? Or they could be active and have some needs and have established Medicaid targeted case management. Okay, so your waiver, you're always active all the time, all day long till you get out of the waiver. With folks that do not have a waiver, you can either be active or inactive. If you are inactive, y'all, that's probably why your case manager hasn't called you, right, Sophia? I mean, they don't call, you lose track. In defense of case management, there are agencies that have thousands and they can't possibly staff it, Our thought here at the ARC is just a little bit different. We're a little bit smaller. We want to make sure everyone that has an active need, I don't care if it's IEP support, I don't care if it's I need help with my electric bill and need resources right now during COVID, whatever, how small, how big, we want to make sure that anyone who needs services gets them. And it looks like the same case management that the waivers get, right? The funding might be different, but the service is the same at the end of the day. There are still going to be those folks who just say, you know what, I'm not ready for it. I had a mom of a child, he was 5 and had Down syndrome, and she came in here and she said, I've never wanted case management till now because I just couldn't deal with it yet. I just couldn't. She was dealing with things in her life, and that was okay. He was inactive with us, but the minute she called, we're on it. We're like, okay, let's come do a home visit. Let's do an assessment. Our assessment consists of not just what's happening with our little person or our adult child, it's what's happening in the family, because we know all that, wraps up into affecting everyone. So we do understand that there might be times that people just don't need anything and they can Go over there to inactive, stay out of services for a little bit. Our biggest thing here is that you know who to call when you do need something, when you go into crisis. And so that's why we feel like keeping people active case management, even without that waiver, helps them. It helps prevent crisis. It helps prevent that, oh my gosh, now what do I do? The school just said this to me. I don't know what I'm going to do next. You know?
You just brought up a great question. So especially right now with everything being the way it is and some places are closed and what have you, if people are in crisis and that it looks very different for everybody, they can call the ARC and you can point them in the right direction.
Absolutely. Absolutely.
Okay.
Mhm.
That's good to know.
Yeah.
We have a lot of families listening that might be in that situation and they don't know who to call and they don't know where to go.
Right. And it's so hard. And so our waivers, y'all, and it's kind of, we're kind of talking about it all together. So we'll have to double back around if I miss pieces. But those waivers that we have in our state are going to help during that crisis. They're going to provide some respite payment. They're going to provide personal care aid if that's what's needed. They're going to provide widening doorways so that your wheelchair can get through, or bathroom assistance with, grab bars, or a shower that you can roll up your 30-year-old into, to help with bathing. So it's so important to be on those waiver wait lists because those waivers are they're funding bans in order to provide supports into people's homes so we can prevent out-of-home placement and the need for it. DDSN is the agency that wants to give families as much support as possibly justified in order for everyone just to stay put and families not to feel stressed and overwhelmed. Because the other side of that is the mama that calls me and says, I just can't do this anymore. I can't do it. I don't know what I'm going to do. And they haven't been active for 5 years during puberty, and it's like, oh, where have we been?
Yeah.
So, it's really a big deal. These waivers, really a big deal.
That might be a good time to explain, like how we started the call. You don't want to miss that time that you're on the waiver list. Why are these waivers so important? And can you walk us through the big mama and the little mama?
Sure. So, the waivers, they're not supposed to have waiting list. Okay. We're in federal violation at this point in our state. We don't know what to do about it because unfortunately we don't have enough money. We don't have enough providers, all this typical things that other states are dealing with. Right now, our waivers are at the IDRD waiver is at a wait list of about 13 to 14,000, and the CSW is probably, I think I saw the numbers the other day, like 8,000 or 9,000 folks ahead of you if you get on right now today. So getting the word out in EI to EIs, don't let your EI say, you don't need to be on that. If that slot comes up and you're in EI and you get a waiver slot because somebody has put your baby on the waiver, please call a case manager. Let them walk you through. EIs don't know. They don't need to know. It's not their job. That is not their job to know. And believe me, they know, they have to know enough. So in the case that anybody's waiver number has come up, don't turn it down till you talk to somebody. And really, we can rule out that there's absolutely nothing on one of those funding bans that can help. Okay.
So I know we're running out of time, but it's okay because we want to make sure we go over everything. So don't worry about that.
Okay.
Do you mind if we back up just a second, Becky? For someone that's listening that has no idea what the ID, RD, and the other waiver is, do you mind just backing up and explaining what those are, please?
Not at all. In our state, we have, like we were saying, we have these agencies that provide funding in order to support families. So case management is an example of that. In our state, there are agencies besides Department of Disabilities that provide case management. Okay. So you have your Department of Mental Health. They have waivers, they have things, they have case management. You have community long-term care, and you guys might know about that agency. That's how you get the medically complex children's waiver. That's how you get community choices waiver. And they also provide case management, right? So all of these other state agencies have their things too. What we have here at DDSN is the head and spinal cord injury waiver. Okay, so that means somebody has to be injured in an accident. We have the intellectually disabled, related disabled waiver. That's your IDRD. That's the big mama. That's the grandfather. That's the one that doesn't have a cap, and you can access more services. And we'll talk about that specifically in just a second. And then the third waiver that Department of Disabilities and Special Needs manages is the community supports waiver. And that is more of a capped waiver. You can get some things, not everything, underneath that. Now, what you have to have in order to access one of these waivers is Medicaid. Okay, guys. So, I've heard it all. I've heard, I don't want to take from the state. I don't want to get Medicaid. Well, it actually helps our state. When anyone who is Medicaid eligible gets it, becomes eligible, we bring down federal dollars. So it actually helps us. I'm not saying you have to drop your private insurance. It's only a secondary insurance if you already have it. It's definitely worth looking into. It is a booger. It's a booger of an application. I'm just going to say it. Your case manager could help you. Family Connection can help you. There's a number on the application that you could call to help. Don't let that stop you. You just tell somebody, I need you to come here, sit beside me, and help me fill this thing out, because it is confusing, right? So you have to have your Medicaid in order to receive this waiver, and you have to meet a certain level of care. Now, folks who are already eligible for Department of Disabilities and Special Needs will meet our level of care. So that's kind of a given. They have to have a diagnosis of autism, a diagnosis of a related disability, cerebral palsy, something like that, or intellectually disabled. And that would be an IQ of 70 or less. So you have to meet that criteria, and you have to have Medicaid in order to access the waivers. Okay. The two waivers that the ARC manages is the ID and the CSW. IDRD waiver, intellectually disabled, community supports, CSW. Okay. These, the other stipulation to this waiver, I will tell you just on the cuff, you have to need it, right? Because there's 14 million people waiting on it. So DDSN says in order to keep it, you have to keep your Medicaid and you have to use it. So every 30 days, there needs to be a service in place. So that means if you're using respite, 1 hour a month of respite is all you need. If things went crazy on you during COVID and you wanted to pull out for a minute, that was completely okay with DDSN. No one lost their during the COVID pandemic. However, typical times throw it out the window. If you're not using it, we have to give it to somebody else, and so that's the other stipulation, is just to use it. The waivers will change for your person. When they're little, they may need certain things. When they're big, they may need other things. When they're even bigger, they may need nothing at all, and at any point you don't need it anymore, you don't have to have it. You can just bump back down and get on the waiting list. Okay. Services that are paid for through the waiver. And you guys, I'm going to give you these. So again, don't worry about taking a bunch of notes. Some adult services we have: adult attendant care, adult companion, your day centers, your day programs, some transportation to and from those things for adults. At age 21, personal care aid ends for our guys. So the waiver will then pick up the cost of personal care. It will also pick up the cost of dental, vision, some audiology, some hearing aid stuff, things like that. We have a service that's called behavior support services. It's not ABA, unfortunately, but it is a consultation with parents about their children's behavior and how to change it. But it's not direct. So it's not someone coming in doing that. career preparation, community services, employment services. In our state, vocational rehab, for anyone who has got an 18-year-old or up, is the employment agency to go to first. But if that doesn't work or that's just not appropriate, we have employment services to help our folks get jobs and be successful in the community on this waiver. At age 21, diapers and wipes aren't covered anymore by your regular Medicaid, so this picks it up. We now have pest control on the IDRD waiver. If you know somebody that has bed bugs or needs, general pest control treatment, that can be paid for. I talked a little bit about environmental modifications to your home. That's another area. Private vehicle mods, if you need a ramp to get your child in and out of the car, that can be paid for.
Becky, I have a question for you, and to
Specialized
everybody,
medical equipment.
I have a question for you. I'm sorry. And everyone, Becky's reading off some really helpful
Great.
pamphlets that we're going to drop in the comments so that you have access to them. One of the questions I know that came up was, can you fill out the waiver yourself, or do you have to have someone send it in for you? How does the actual application process of the waiver work?
Okay, that's a great question. So when you're going through intake, if you're brand new to the system, the person at DDSN who is doing your intake can actually put you on your child, your loved one, on the waiver waiting list right then at the entry point into DDSN.
Okay.
After that, your case manager needs to do it. It isn't something that you wouldn't want to fill it out. Let me just tell you that it's a request that's kind of outdated, and it's just not something that we want the family to ask us for help for that.
Gotcha.
They don't need to take that on.
Okay.
So yeah, it has to come through our entities.
Some families may not know that they need help with the waivers. So just to confirm, everybody, if you want to get on the waiver list, you need to reach out to your case manager. And we have a mom that asked for you to run through the steps of getting a case manager one more time, just from start to finish. What do they do to pick up the phone and call?
So if you're new to the system, you call the 1-800 number, which is going to put you in touch with DDSN's intake line. Okay. It's a 1-800 number. You'll get it in one of my flyers. You call them, you tell them about your loved one that you're doing the intake on. You try to gather as much information on them as possible, and they will screen you into services. Okay. Then you'll be provided with an intake provider, and you'll come on in. You'll be contacted. You'll be asked about the different things that your child does. And then you'll become eligible for DDSN and then offered a case management agency, right? Now, during that point, you can still ask them to put you on the waiver wait list, and they'll probably ask you, okay? If you're not new to the system, you already have a current case manager, you'll want to either tell your current case manager that you would like to switch, or you contact the case management agency of your choice and you tell them, I don't know anything. I don't know. I'm not, my needs aren't being met, and I'd like to come to you. At that point, we would send you a form and we would do the rest. Okay. The other way too, your EI can do this, right? Your EI can put you on the waiver wait list. They know how to do that.
Great. Thank you. We had someone saying, could you run through those steps one more time? So thank you for doing that, Becky.
Absolutely. Absolutely.
Hey, Becky,
So,
I got a question. Can
Yeah.
I ask you something? So for parents who have older kiddos that are quickly approaching 17, 18, I get a lot of questions. My son has autism. He's 17 years old. Now what? What happens? He has tephra, correct me if I'm wrong, at 19, the TEFRA goes away, correct?
That's right.
Okay. And
That's right.
that's why we need to make sure that our kids are on these waivers, because once TEFRA goes away, how do
let
we,
me, right. So that's a great question. So we have a whole module, y'all, of what happens when my child grows up. We have information about guardianship. You have to think about, what happens. Your child will be signing their own paperwork at 18 if you don't get guardianship. And the ARC doesn't promote guardianship, y'all. I think it's an individual choice for each family. We can provide a wide range of resources because there's all kinds of ways to skin that cat, if you know what I mean, with conservatorship, power of attorney for just healthcare, for just this. I mean, there's so many options for that. So I'm not going to go into too much of that, but you got to apply for SSI because at age 18, that Medicaid is so 19 is when TEFRA ends, right? Like Sophia says, the thing is it goes through 19, but at 18, you need to apply for SSI because SSI is coupled with your Medicaid. The TEFRA staying put till 19 is kind of that safety net that lets you get things done during that 18th year, right? Okay. So at 18, that young person becomes an adult and they no longer, the system does not look at your income as parents anymore. It looks as their income. And if they're not working, their income is zero. And guess what they qualify for? An SSI check, which will help you. SSI is designed to help parents pay rent, help parents buy clothes, help parents do all kinds of things for their pretty much adult child. I know I have an 18-year-old. I don't think she's an adult at all. So, but it is the age of adulthood, So it's hard for us to think about, and it happens in a blink,
I don't want to think about that, Becky.
There are so many important things.
I don't want to think about it. Don't grow up. Don't grow up.
Know.
So going back, and you know me, I can be transparent. I just want everyone to learn. So, for those of you that don't know, I have 3 boys. 2 of them have autism, moderate to severe. My oldest with autism is 9 years old. I had the impression that Jack was on the waiver lists. And a few months ago, I made the switch to ARC after having a fabulous 3 or 4 hour lunch with the whole ARC team in Bluffton at Jim and Nick's. I think we shut down Jim and Nick's, didn't we, Becky? But anyway, so we did. And I made the switch to ARC, and guys, we learned that my sons were not on the waiver lists. So I'm panicking a little bit because Jack is 9 years old, 18 years old. He's going to be 9 more years. He's an adult. What's the waiting list for the time for the IDRD and the community support waivers? So Jack could really be already in his 20s before he even comes up. So my worry is paying for necessities during that time where Jack doesn't have TEFRA. The IDRD and community support has not come up yet. So just trying to get it out there, people, that you got to make sure your kids' names are on these waiver lists. And so, Becky, I don't know if you can answer this. What do we do?
How do we find out if we're on the waiver list?
So, as I was telling you, if anyone does not know if they have a case management agency, I can find that out. I can pull up on our system. I can't see a thing about anyone's children, but I could see the agency that somebody is with. And I can say, oh, you're already in the system. You're with Bright Start, or you're with the board, right? And I can do that. I cannot do that with waiver waitlist. There is a system that your case manager can go into, and they can actually pull it up fairly easy to find out what the number is. And if they see nothing, they're not on. I do want to interject this, y'all, right here, because I hear desperation sometimes, a lot of the time, when, the IDRD waiver waitlist is probably 10 plus years right now. If there were something to happen that was crucial, that was a crisis, that, God forbid, primary caregiver passed away, something like that. And there was, the person that stepped in really, we can skip that list. Okay. We can skip that list for critical situations. And I see it when, a 22-year-old comes in through intake and they're in the hospital right now and their family can't take them home, right? Because they can't do it anymore. So we do have those situations where if something is really critical going on, they're trying to harm themselves, they're trying to harm you. There's not a primary caregiver, there's an aging caregiver. We can come in and say, you know what, we're going to petition DDSN to skip over those 10,000 people, and we're going to get that person some supports. So I don't want fear or desperation to come in and overtake families. I think it's a healthy fear to have. Oh boy, let me find out if I'm on that waiver wait list. But if it's, a situation later on in life, that it's just unbearable, there are ways. And just a side note to that, again, there's so many pieces. You can do a part 2 if you want to. If you're not eligible for Medicaid, let's say your child just scored really good on some testing and they're found not eligible for Medicaid based on disability. That doesn't mean you wouldn't be eligible for, and I'm thinking of autism, y'all. I'm thinking of our folks that are, geniuses. They're not going to necessarily meet the disability criteria for Medicaid, but they're going to be eligible for us forever because of their diagnosis. There are some state dollars that DDSN has and has put in place for certain services, respite, employment, things like that, for those folks who will never be eligible for Medicaid. But you know what? That autism isn't going away. It's still there, right? Medicaid eligible or not, it's still there. So they put in a funding source for that is separate from the waivers. It looks like a waiver, but it's separate. It's a separate pot of money.
Hey, Becky, you're obviously a huge wealth of knowledge because we're getting some great questions. I have a question for you. What is your recommendation for transition-aged consumers for waiver services? We have a lot of students who drop services after early intervention services are no longer needed. And during transition age to 18 to 21, families are trying to access services and are then placed back on the waiver waiting list.
Yeah, that's exactly what we're talking about. They probably were eligible if they were with EI, right? And it might be that some of those, I feel like that might be a high school special ed teacher or something, but I feel like that, there could be a chance that some of those kids could still get case management, y'all, because not everything is funded through the waiver. There are some other resources, and I have that for you as well. We can access some family arranged respite. We could always refer over for personal care that's paid through for regular Medicaid for our kids. Not everything has to be through the waiver. So it does meet a ton of needs. It just meets a bulk of what we do need, but it's not everything. And there are still things that a case manager could help a family with, even if they were put back on the end of the waiver wait list in that situation. Yeah.
I'm thinking because you're so popular and we have so many questions, it might be worth having you come on again for another live session where people can ask you questions, because you know everything and there's so many different situations. So
there are.
You're a wealth of knowledge and we appreciate
happy to share. Pick my brain. I'll give it all to you. Anybody who needs it.
Specific questions that we didn't go over, Sophia.
Internet is breaking up. I'm sorry. Tell me again.
Yeah, say it one more time.
I was just saying, did we miss anything that we should cover before we say goodbye to everybody? And we'll make sure to have Becky back again.
So,
Yeah.
right. So just one more minute. So the services, guys, that I was reading off the IDRD waiver, they're very similar to some on the community supports. The difference is just nuances, right? So community supports, you get this much money, and when it's gone, you can still have your waiver, but you used it all up. With the IDRD, the grandfather, the big mama, that's going to give you more services because it's not a financial cap. It's more of a service limit cap, but it's still based on need. So I never want to say a limit because it's really based on need. So you will have this information for you in some stuff. As far as the questions go, Sophia, that you sent me, we talked about case management, active and inactive. I just want to make sure I've hit all the highlights. Your case manager, y'all, bottom line, it is that person that is going to guide you, navigate you through that maze of lifelong systems. Where do you go next? What do you do? They're in that circle of support with you, so that really just kind of holds some weight there. Contact your case management agency to make sure you're on the list. You could be inactive. Just ask them, hey, am I active or inactive with you guys? If you don't know who that is, contact me. My email is so simple, becky@arcsc.org. I can let you know. You can call me. You'll have my number later. And if you don't have services at all, make sure you just go through the intake line through DDSN at the 1-800 number, which you will also have access to.
Becky, thank you so much. You have been so helpful and you are amazing. We're going to be harassing you because you know everything.
Oh, I don't know. I don't. Margie does, but I don't. But together we're pretty good. But seriously, in all seriousness, y'all, it doesn't matter. I don't care who you have for a case management agency. If you have questions, the important thing is just get them answered. So we're happy to help.
And everybody, we will definitely get Becky back on live and you can continue to ask her questions. And we will be sure to answer them, and we will drop all of the information that she went over into the comments as soon as the meeting is over. So thank you everybody for joining us today.
Take care.
Thank you guys.
Bye.
Bye.